Welcome to LifeBlood. This is George G, and the time is right. Welcome to today's guest, strong and powerful Dr. Aaron LeBauer. Aaron, are you ready to do this?
I'm ready, George. Thanks for having me.
Yeah, excited to have you on. Dr. Aaron is the host of the Cash PT Lunch Hour podcast. He's the author of Cash PT Blueprint. He's a speaker. He's helping physical therapists scale their time, impact, and income without just relying on insurance. Aaron, tell us a little bit about your personal life, some more about your work, and why you do what you do.
Yeah, I think personal life wise, I have family, wife, two girls, and love skiing, riding bikes, vintage cars and scooters, and I don't like I've done a lot of different jobs in my life. Let's see what I do for work. I do two things. We own a physical therapy clinic where we help active people in Greensboro stay fit, healthy, and strong without pain meds, injections, or surgery. And after building that business, people asked me how'd I do it, and we built that business without relying on insurance companies for reimbursement because that creates a lot of times it creates a conflict of interest in what's right and best for our patients. And so I started teaching people how to grow their business and do that. And so I have a consulting business that helps physical therapists and other healthcare providers create or launch six-figure businesses and scale them to multi six figures in multiple locations to help so that we can help thousands and even millions of people avoid unnecessary surgery and expensive imaging. And the main reason is because as a therapist treating patients for over 20 years, people keep coming back with the same stories like, I wish I never got this surgery, or you were the first person to touch me where I hurt, or I was told never to lift 35 pounds ever again. How am I going to get back to picking up my baby, washing my dog, or even doing CrossFit? And there's a lot of misinformation, miscommunication, and I believe a lot of it happens because healthcare providers don't have any time to sit and help you understand what's going on. And that's what we were able to do.
Nice. I appreciate all that. Tell me more about the scooter part, Aaron.
Yeah. Well, I used to race bicycles, right? And I lived in San Francisco, and I started working with a coach, and I was training really hard, but I had to commute to work, and I was like, man, I'm too tired to ride across town to go to work, and I was working as a massage therapist, so I mean, I was expending a lot of energy, and so I was like, maybe I'll get a motorcycle. I was like, motorcycle's big. Let me check out these scooters, and there was a big vintage Vespa and Lambretta scene. These are metal-bodied scooters from Italy from the 60s and 70s, and it's really big in San Francisco. And I rode one, and I fell in love. And so I got one to commute around town on, and then moved to North Carolina, where there's probably a dozen or two dozen people here with vintage scooters. Maybe there's more, but like I know of like 2 dozen people max. I'm like the only person in Greensboro who actively rides, and I had to be resourceful. And when something would break, I had to figure out how to fix it. And I've since in the last 15 years rebuilt multiple scooters, rebuilt multiple engines. Bought them, fixed them up, sold them. I bought them for $400, sold them for $2,300. Yeah, it's really cool. But it's something I can do with my hands and create something, see some work, enjoy it, and even pass it along to the next person.
That's awesome.
Yeah,
Love it. Nice. All right. So it strikes me that it is, I wrote down problem of insurance,
yeah.
where it's a problem because so many people rely on it. And it's a problem because we think that it's just the way that we get healthcare is through the
Mm-hmm.
insurance company. And probably a lot of the practitioners you're working with, the doctors you're working with, are sort of locked into it and trapped.
Yep.
Is it better to start with the end in mind of I'm not going to take insurance? And is it possible to unring the bell and to unwind and detach my practice from an insurance model?
Yeah. Like if someone's getting started, I think it depends on your philosophy and the scale you want, right? I think it is so number one, I think it's better to start without insurance because insurance reimbursements are going down. They've been going down for 20 plus years. They're not going to go up. And so what that means is in order to pay the bills, we have to see more people per hour. whether we know it or not, they're geared towards generating revenue, which isn't a lot of revenue. It's just we have to generate revenue to pay the bills, and so we start. I feel like shortchanging most patients, not all patients. Some people, it's a perfect model because that's what they need, and others, they just need more. Yes, it can. You can unring the bell. I've worked with dozens of clients, even more than dozens probably at this point, who were insurance based, and they're basically their cost to treat a patient is $80, but their average reimbursement is $72. So we're negative $8 for most of the patients. So they can't stay in business and continue to accept insurance. And really, what it means is the practice has signed a contract with the insurance provider like Blue Cross Blue Shield to provide services at a specific rate. A lot of times people don't understand what that really means. They'll sign this contract, and that rate is lower than their cost of operations. So the cost to run the business, cost to pay the employees, and a lot of owners end up taking a pay cut or a hit on their personal income because they have to pay their staff's salary. So the real problem is what I see the real problem from a perspective of the therapist is, do I do what's right for my patient, or do I do what I know is going to generate revenue so I can pay my employees? And I feel like that's an ethical question. I shouldn't have to answer in healthcare. And other people see it as, well, people have insurance. They are entitled to use their insurance. Probably because I have insurance, I should feel entitled. You should accept insurance. Well, if the math isn't right, the math just doesn't work. And so how can I help people if I can't stay in business?
Yeah. Well, that when you lay it out like that, it certainly does. I was going to say it makes sense, but it doesn't make any sense at all. Why
No.
why would I sign a contract with an insurance company that's going to pay me less than it costs me to provide the care? I guess that's probably a whole nother podcast. But
Yeah.
what's
It is.
let's 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 talk about the way forward and how you were able to do it differently.
Yeah. I think the number one thing that I think your audience can get out of this is the way that we do it differently is through customer service and sales, not marketing. Yes, marketing, we market differently. I do more direct response marketing than most, like traditional clinics, but it's about the sales and enrollment. So if I'm a physical therapist and I believe that my treatment is exactly what you need because I've asked you questions and done a short like examination, then it's my ethical obligation to sell the service to you. Because probably most people here listening have heard of physical therapy. Some of you have said, oh, physical therapy doesn't work, or I tried physical therapy, or it's only for, if I get a surgery, physical therapy can help me. Well, the thing is you're right. No one knows what physical therapy really is. Physical therapy means so many different things. There are physical therapists that do wound debridement. You've got a necrotic ulcer, like a dead tissue. Like as a physical therapist, I can debride it and clean the wound for you. I can do what's called electrophysiology testing. I can do testing to see, are your nerves transmitting signals correctly? And there's so many different women's health and orthopedics, and then there's there's education. There's so many things. So if I know I can help this person, I can't try to give them physical therapy. I have to sell them the transformation that they want to make in their life. And if I can help them do that, it's my obligation to sell it. And I'm not selling you something you don't need. Like you don't need a Porsche 911. You can get around in a Yugo. If there are any still left on the road, right? But a lot of healthcare providers are like, how could we possibly do that? That's unethical to sell. Well, selling isn't coercion. Selling's asking the right questions, right? And as business owners, we know, like, in order to sell our services, I have to find out, do you actually need it? And that's the main thing that we do differently is we take the time to ask you the questions. What's going on? How long has this been a problem? What issues is this causing in your life? And a question like, George, say you could snap your fingers and produce one outcome working together with us in the next 90 days. What would it be and how would it change your life?
If you
And
could get my
this,
back to stop hurting,
yeah,
and it would change everything.
yeah. And then I would ask you why. Why is getting your back to stop hurting important?
I could get around without pain. I could play with my kids. I could exercise
Yeah.
again.
Yep. And why is playing with your kids and exercising again important to you?
That's what made me happy.
Yeah. Great. And are you able to do that now?
I can't.
Right? Okay, if I could help you get back to playing with your kids and exercising again so you feel happy, you know, do you think that, would you like to work with us? I'm like, I would
For
use,
sure.
right? But most people are going to come in and say, okay, you can't touch you've got this limited range of motion, you've got this diagnosis, let's do this back pain protocol. Like I can go get the back pain protocol on YouTube or Instagram. Let's see if it works. But so this is a sales conversation that I took from my coaching programs. Like I learned how to enroll people into my coaching programs. I was like, wait, I should be doing that in my clinic. And at the time it allowed us to raise our rates $100 per visit. But we don't sell physical therapy per visit, we sell programs. If that makes sense. So I sell you an outcome, it's going to take 12 weeks and I'm going to see you 8 times in those 12 weeks.
It does, and it makes perfect sense.
Yeah.
I mean, talking about the outcome versus just feeding people on a conveyor belt of
Yeah.
therapy. Like, okay,
Yeah.
you've got number 4. All right, you go over there and you're going to go
Right.
through that.
Right.
Makes perfect sense, and
Yeah.
it also makes perfect sense why
Yeah.
a lot of the physical therapists and other practitioners in different fields. I'm sure that this is a pretty common problem among anybody
Mm-hmm.
that's working with insurance and medicine, that they don't have the sales skills. They don't understand the mindset, the perspective that you're talking about. And so it's hard to bridge that gap.
Right. And it's very different than me saying, like, let me sell you a surgery that may or may not be necessary.
Mm.
Like physical therapy is a very low risk, we call it an intervention. It's a low risk, option for treatment of pain and injuries. Like the highest risk you have is getting burned by an ice pack. Like your skin can be burned by an ice pack because after a while you can't feel it. Well, you know what? In our clinic, we don't do ice packs because we spend time with you. We don't leave you alone. And so there's really no risk, other than you wasting some time and maybe some money. Like it's not a health risk versus surgeries where you can get an infection, you can die, you can lose feeling in a leg and limb. There's a lot of, like you can get an ulcer from eating too much Advil because,
Sure.
The Rock eats Advil on his show. They crunch opioids. With Jason Statham and The Rock, every movie they have them crunching some opioids. Like there's a super high risk to that. So we're selling something that has very little risk, a lot of upside.
I've never thought about how action stars are popping pills in movies and the impact that that's having on us. Interesting. That's a whole nother
Right.
podcast too, Aaron. All right, and the departure here is now I need to get my patients to come out of pocket for this service versus
Mm-hmm.
having it paid for by insurance.
Mm-hmm. Exactly. So a lot of our patients have already been somewhere else and they were like, that didn't work. Or that wasn't the experience I wanted. People said, oh, Dr. LeBauer, I could do those exercises at the gym. I'm like, yeah, I know.
Yes.
You can do those at the gym because they're, um, and then there's people who don't know about physical. So it's a small subset of people who've already been a PT. What I really want to do is reach the people who've never experienced it, and that's where the marketing comes in, where we're talking about talking to them specifically and about their needs, wants, and desires, not about physical therapy. And what we have to do is we have to show them, that we can help them, and then if we feel good working together and we can help you feel like this is the right place to reach your goals, like we'll lay out a plan. And there's plenty of people that say no to us because they're like, well, I need to use my insurance, and they can absolutely do that. Too few people. There's a few people come in. I say too few because I think a lot of people like check their ego and don't come back, but there's a few people come back and say, I should have come to see you in the first place. Like I went to the other place, I wasted a bunch of time. I should have just come back here in the first place. And I think a lot of people are afraid to come back because it means they've made a bad decision. Actually, the bad decision is making no decision, right? So, I think that's, to me, that's my biggest fight is how do I bridge that gap earlier on? And I think as insurance reimbursements continue to decrease, we've got a new regulation out. You have to provide a good faith estimate for healthcare services. As people start seeing those from traditional places, they're like, "Wow, that's a lot," and that's going to start. It's starting to change the landscape a little bit.
Fascinating. What just jumped into my mind is what if there was some kind of program or insurance that paid for somebody to have access to financial education because they're
Mm-hmm.
financially sick, and if
Right.
they were to go through the insurance, they would get A, B, or C kind of a thing, and what
Yep.
that experience would be like, and then what a financial advisor would say, well, this is the benefit you're going to get from working with me and coming
Right.
out of pocket and paying it, and it'll be just a
Yeah.
completely different experience, and potentially it's actually going
Yeah.
to solve your problem and get you on the path to the life that you actually want.
Right. Yeah. No, that's an interesting question. It brings up two thoughts. I think number one, I just want to be clear that our patients do file self claims for insurance, and it is covered. We just don't file the claim on their behalf. They pay us first, and they can choose to file a claim. Most people's deductibles are so high that even with 2 rounds of physical therapy, they won't reach their physical therapy and a surgery, they won't reach their deductible. Um, and the second part is having this money conversation with people, like, hey, you will probably actually save money working with us versus going somewhere else, isn't really a conversation that works because it's too logical. People buy on emotion. And then what happens is if I get into this conversation with you and say, hey, George, 8 visits with us is going to cost you $2,000, but if you go over here, you've got your copay plus they're billing $350 per visit or unit. Like, there's no way for me to know what they bill, right? But they probably do. You're going to come out paying more, but now people are thinking, but wait, why am I paying for insurance when it's going to be more? So it doesn't make sense. It feels like it should be free or covered. Okay, so if I choose you, then I've definitely made a bad decision, whether it's about choosing physical therapy or choosing an insurance plan. Somehow I've been duped, so they're not going to come and see us because now I've broken down it way too logical, and someone's doing something wrong, but they're not going to come choose us. It's because it's too logical. And I think that as consumers, like my personal health insurance, like I have like a 5 or 7. I think we have a $5,000 individual deductible, and as a family, we have a $15,000 or $20,000 family deductible max, out of pocket max. It's basically insurance. It's catastrophic insurance, so that we won't go bankrupt because someone in my family's in the hospital. Rather than it's not something that covers the oil change, right?
Mm-hmm.
Which, like, physical. It's a bad analogy to say physical therapy is like the mechanic, but in essence, pain is like your check engine alarm, and insurance doesn't cover you getting new tires in an alignment every 3 years.
I think that's
You
great.
know,
Makes sense.
yeah,
Well, Aaron, the people are ready for your difference making tip. What do you have for
yeah.
them?
I think the number one thing I think as a business owner that makes the biggest difference is asking for help, being quick to ask for help. So whether that's asking your current mentor for help or finding a mentor or business coach, um, taking action and implementing what you learn, whether it's something your business coach tells you to do or some strategy you learn, you have to take action on it. Otherwise, it's not gonna, like, you'll never succeed because, um, like I think Wayne Gretzky says, you miss 100% of the shots you never take. And then you have to share your wins and your lessons. The only reason I'm here talking to you is because I started sharing what was working well for me. Um, and so those are the big three things that at least make our Platinum Mastermind members successful, and I know make most people successful, is ask for help, take action quickly, share your wins. And then the fourth thing, or like the real main thing, that's on the back of my sweatshirt today, but you can't see it, It's 80% is good enough. As business owners, it doesn't have to be perfect. It just has to work, So 80% in business is enough. It's good enough because perfection will kill your business.
Well, I think that is great stuff. It definitely gets it. Come on. I love it. Those are solid. Aaron, thank you so much for coming on. Where can people learn more about you? How can they engage with you?
The best way to find me is over on Instagram at Aaron LeBauer. It's AARONLEB as in boy, AUER. Instagram at Aaron LeBauer, or you can go to aaronlebauer.com.
Perfect. Well, if you enjoyed this as much as I did, show Aaron your appreciation and share today's show with a friend who also appreciates good ideas. Find Dr. Aaron at Aaron LeBauer on Instagram and then aaronlebauer.com. That's AARONLEBAUER. And I'll link all that to the notes of the show. Thanks again, Aaron.
Thanks, George. Appreciate it.
And until next time, keep fighting the good fight. We are all in this together.